wanted to ask you just about the ICRC and your particular operation in Beirut. How much has it been affected by the explosion in terms of what you were able to do before Tuesday last week and what you can do now?
Thank you for having me. Let me start by saying that 1 week after the blast, the hospitals are still overloaded with patients, hundreds of injuries that still need to be treated. A lot of them are life-changing injuries, meaning that they would also need long-term follow-up, whether in hospitals or outside hospitals, but like with doctors. As you mentioned, 3 hospitals are still totally out of work, so they cannot function. All the injured or the patients actually that were in these hospitals had to also be transferred to hospitals outside, which meant more overwhelming numbers of injured to be treated in Beirut hospitals. So this is something that we see is still going to be a huge issue in the coming days and weeks, because there is a need for medical supplies, but there's also need to work on the infrastructures of the hospitals that were severely damaged, knowing that these 3 hospitals were big main hospitals in Beirut, receiving thousands of patients. So what we have done as ICRC, the night that the blast happened, we did a support for 12 hospitals in and around Beirut. We supported them with medical supplies, and this is something that we continue to do. So this is something that is ongoing for us as ICRC, supporting hospitals, but also other centers providing healthcare, in addition, of course, to supporting the Lebanese Red Cross and other organizations working on responding during or after the blast. However, there's also another I would mention, which is like the wounds that are unseen. And here we're talking about the need for mental health support. We believe that this is something that's going to have, unfortunately, a big impact on the mental health of the Lebanese and residents of Lebanon. And this is why also we as ICRC have dedicated a hotline for those who need such support, mental health support, in our center already existing at Beirut's biggest governmental hospital. We believe that mental health is as important as physical health. So I would really advise anyone who needs support to go to our social media accounts and check out the hotline and call if they need this kind of support. So this is only on the medical aspect. And of course, the hospitals have been already struggling because of the economic crisis, because of fighting the coronavirus pandemic. And we have seen a big rise of the numbers of COVID-19 patients in the past days, which is very worrying in the coming days, because after the blast, people were gathering, they were not doing social distancing, they were not taking the measures that need to be taken to protect themselves from the coronavirus pandemic. So this is something that is also worrisome in the coming days, knowing that the Minister of Health has just had a press conference where he said that they are indeed expecting a big spike in the numbers in the coming days and weeks. And this is also only about the health aspect of this big blast that has had effect on several other sectors as well.
Of course, Rona, can I ask you on a scale of 1 to 10, if 10 is where ideally you want to be in terms of the assistance that you as the ICRC can give to the people of Lebanon, where are you at the moment? Because, of course, the damage to infrastructure and logistics and supply chains and all of that, I suppose you as ICRC Lebanon are now waiting for supplies to come in from abroad. So where are you on that scale of 1 to 10?
Okay, I wouldn't give a specific number, but what I can tell you is that indeed now that the port is also unfunctional, what we have been doing so far is using the stock that is already existing. However, we have new supplies that came into the airport last night, so it's being airlifted instead of going through the port. The aid we're talking about is medical supplies, but also food items. And we're talking also about ready-to-eat food, because a lot of people, we're talking about at least 300,000 people who have lost their homes, and they don't have kitchens anymore, basically. They don't have a roof on top of their heads. So these would need a ready-to-eat food. That, in addition to the assessment that we started to do very early on after the blast, in terms of the infrastructure, we're talking here about electricity and water stations that have also been affected due to this explosion. I can give you an example of a water station that we are assessing, and we will be working on to try and make it up and running as soon as possible. This station is in Ashrafiyeh, and it serves at least 12,000 households. So for us, there is a whole range of needs that we are trying to support. Of course, the fact that the port now is not functional might cause a little bit of delays in terms of the humanitarian aid, whether for the ICRC or other organizations also working on the ground. And talking about the ICRC here, this is not only aid coming to Lebanon, but also much needed aid going to Syria through Lebanon.
Rona Halabi, thank you so much indeed for your time and good luck with your work.